Hello, my name is Marc Bidaux. I am 42 years old, have 2 children and live in Finisterre. About 8 or 10 years ago, I suffered from severe nasal obstruction. At the time, I was prescribed numerous sprays such as Derinox and Desktop for the mucous membrane, meant to be used only briefly, but I used them longer than recommended. As a result, the underlying cause of my obstruction, blocked nasal passages due to allergies, was never addressed, and my condition only worsened. Tired of my constantly blocked nose, I consulted several ENT specialists to find a viable solution. Fully aware of the possible complications, including empty nose syndrome, I sought advice and information about potential surgeries. Eventually, I met an ENT specialist at Brest University Hospital who seemed competent, serious, and open to discussing the risks. She reassured me and suggested a minimal turbinectomy, removing just a few millimeters of the turbinates. She provided detailed drawings showing only a slight cut. Still concerned about the risks, I asked if a turbinoplasty might be preferable, but she discouraged it, saying it was unnecessary and that I would likely face problems again in 2 or 3 years. My nose was severely blocked, and after careful consideration and reassurance from the ENT, I agreed to the surgery. It was performed in June 2015 and involved a bilateral lower partial turbinectomy. According to the surgeon, the operation went well, and after a few weeks I did breathe better, especially on the right side. At the follow-up appointment, I mentioned that while I was breathing well on the right side, the left side was still blocked. The ENT decided to perform a minor additional partial turbinectomy on the left. I believe this would involve only a slight cut, as depicted in the ENT's drawings. After the procedure, my left nostril seemed less blocked. Although I felt some discomfort, I was breathing better than before, and everything seemed fine. This second surgery, performed in January 2016, was nearly a total lower turbinectomy.
What? No! God, please, no! No! No!
March 2019. Suddenly, and without any apparent reason, my nose became completely blocked for a month and a half. I had forgotten my fears about empty nose syndrome and didn't consider it at all. Treatment involving corticosteroids, cortisone, and spray unblocked my nose, but I had to stop the treatment after 3 days as severe pain emerged. My nasal mucosa felt like it was burning. It also felt too open, with unfiltered, unwarmed air rushing in violently when I inhaled. Since then, my life has been a nightmare. My nose alternates between being congested and too open, resulting in painful breathing, burning sensations in my nose and nasopharynx, facial pain, and intense fatigue. The worst part is the dyspnea, which prevents me from sleeping without medication, as I feel like I'm suffocating and can't breathe automatically at night. Following this, I also suffer from anxiety and depression. How can I continue living and fulfill my responsibilities as a father and at work in this condition? At my job, I struggle without the option of taking a nap. I rely on medication to sleep, and without restorative rest, it's incredibly difficult to cope. This disease, which appears to be degenerative, has no known treatment. I sought opinions from multiple ENT specialists, including colleagues of the surgeon who operated on me. But they dismissed my concerns, saying, "I'm not going to invent a disease for you. There's nothing wrong." Fortunately, other competent and honest specialists diagnosed me with empty nose syndrome, supported by a scan revealing a 90% resection of my inferior turbinates. Since 2015, ENT specialists have noted a degeneration and progressive atrophy of my mucous membrane due to excessively open nasal cavities. Yet they could not propose a solution or corrective surgery. Potential procedures, such as implants, are rare and offer no assurance of success. In Italy, I consulted with Fabio Piazza, who remarked, "You were operated on by a very inexperienced ENT specialist. Due to the associated risks, he declined to perform further surgery and suggested monitoring the evolution of my mucosa before reconsidering. I am now awaiting an appointment in Nice with another esteemed professor known for his expertise in cartilage implants, hopeful for a new perspective and potential treatment. Currently, I strive to live day by day. Much of my energy and zest for life has waned. I suffer daily from the symptoms of this iatrogenic disease. Despite voicing my concerns about the risks and complications of empty nose syndrome, my ENT proceeded with the surgery, removing all of my turbinates. I feel as though I was merely a test subject, now grappling with the aftermath."
You have now listened to Marc Bidaux's testimony. The type of surgery Marc underwent is an ENT crime. Tens of thousands of people worldwide have had their lives destroyed by these procedures, which are always presented as completely safe. Despite the ongoing destruction of lives, these surgeries continue year after year, decade after decade, and no one cares about the ENS victims. They are amputated and left bleeding on the street, botched for life. After Marc wrote this testimony, his condition worsened. On January 22, 2021, he could no longer endure his suffering and took his own life. Marc is just one of hundreds of patients who have met the same tragic fate.